Health tips by Shah G present. Informative video for you. Please subscribe, share and like. Please subscribe, share and like.
A comprehensive guide to breast cancer Part 1. What is breast cancer? Cancer occurs when changes called mutations take place in genes that regulate cell growth. The mutations let the cells divide and multiply in an uncontrolled way. Breast cancer is cancer that develops in breast cells. Typically the cancer forms in either the lobules or the ducts of the breast. Lobules are the glands that produce milk. Ducts are the pathways that bring the milk from the glands to the nipple. Cancer can also occur in the fatty tissue or the fibrous connective tissue within your breast. The uncontrolled cancer cells often invade other healthy breast tissue, can travel to the lymph nodes under the arms. Once the cancer enters the lymph nodes, it has access to a pathway to move to other parts of the body. Signs and symptoms of breast cancer. In its early stages, breast cancer may not cause any symptoms. In many cases, a tumor may be too small to be felt, but an abnormality can still be seen on a mammogram. If a tumor can be felt, the first sign is usually a new lump in the breast that was not there before. However, not all lumps are cancer. Each type of breast cancer can cause a variety of symptoms. Many of these symptoms are similar, but some can be different. Symptoms for the most common breast cancers include a breast lump or tissue thickening that feels different from surrounding tissue and is new breast. Pain, red or discolored, pitted skin on the breast. Swelling in all or part of your breast. A nipple discharge other than breast milk. Bloody discharge from your nipple. Peeling, scaling, or flaking of skin on your nipple or breast. A sudden unexplained change in the shape or size of your breast. Inverted nipple. Changes to the appearance of the skin on your breasts. A lump or swelling under your arm. If you have any of these symptoms, it doesn't necessarily mean you have breast cancer. For instance, pain in your breast or a breast lump can be caused by a benign cyst. Still, if you find a lump in your breast or have other symptoms, contact your doctor for further examination and testing. Types of breast cancer. Breast cancer are two main categories: invasive and non-invasive. Non-invasive breast cancer is also known as breast cancer in situ. These two categories are used to describe the most common types of breast cancer, which include ductal carcinoma in situ, DCIS, is a non-invasive condition. With DCIS, the cancer cells are confined to the ducts in your breast and haven't invaded the surrounding breast tissue. Lobular carcinoma in situ, LCIS, is cancer that grows in the milk-producing glands of your breast. Like DCIS, the cancer cells haven't invaded the surrounding tissue. Invasive ductal carcinoma, IDC, is the most common type of breast cancer. This type of breast cancer begins in your breast's milk ducts and then invades nearby tissue in the breast. Once the breast cancer has spread to the tissue outside your milk ducts, it can begin to spread to other nearby organs and tissue. Invasive lobular carcinoma. Invasive lobular carcinoma, ILC, first develops in your breast's lobules and has invaded nearby tissue. Invasive lobular carcinoma, ILC, first develops in your breast's lobules and has invaded nearby tissue. Following are less common types of breast cancer: 1. Paget disease of the nipple, 2. Phyllodes tumor, 3. Angiosarcoma. Breast cancer stages. Breast cancer stages based on the size of the tumor and how much it has spread. If the cancer is invasive or non-invasive, how large the tumor is. Whether the lymph nodes are involved if the cancer has spread to nearby tissue or organ. Breast cancer has 5 main stages, stages 0 to 4. Stage 1 breast cancer stage 1A. The primary tumor is 2 cm wide or less. The lymph nodes are not. Stage 1B. Cancer is found in nearby lymph nodes. Either there is no tumor in the breast, or the tumor is smaller than Stage 2 breast cancer stage 2A. The tumor is smaller than 2 cm and has spread to 1 to 3 nearby lymph nodes, or it's between 2 and 5 cm and hasn't spread to any lymph nodes. Stage 2B. The tumor is between 2 and 5 cm and has spread to 1 to 3 axillary, armpit, lymph nodes. Or it's larger than 5 cm and hasn't spread to any lymph nodes. Stage 3 breast cancer stage 3A. The cancer has spread to 4 to 9 axillary lymph nodes or has enlarged the internal mammary lymph nodes. The primary tumor can be any size. Tumors are greater than 5 cm. The cancer has spread to 1 to 3 axillary lymph nodes or any breastbone nodes. Stage 3B. A tumor has invaded the chest wall or skin and may or may not have invaded up to 9 lymph nodes. Stage 3C. Cancer is found in 10 or more axillary lymph nodes near the collarbone, or internal mammary nodes. Stage 4 breast cancer, metastatic breast cancer. Stage 4 breast cancer can have a tumor of any size. Its cancer cells have spread to nearby and distant lymph nodes as well as distant organs. The testing your doctor does will determine the stage of your breast cancer, which will affect your treatment. Disclaimer: we will often use men and women in this video to reflect the terms that have been historically used to gender people. But your gender identity may not align with your breast cancer risk. Your doctor can help you better understand how your specific circumstances will translate into breast cancer risk factors and symptoms.
If you like my video, please watch, share, like and subscribe.
A comprehensive guide to breast cancer part 2 very soon. Second part of breast cancer video is release. If you like my video, please subscribe, like and share. Health tips by Shah G.